Good morning. I'm Rana Assaly from Pelvipharm Group, a group with 20-year expertise in preclinical studies in sexual medicine. Thank you for this opportunity to present the results of the study entitled Prolonged Pro-Erectile Facilitator Effects of LIB01 in Anesthetized Western Rats. This study was supported by a restricted grant from Dicot and experiment performed at Pelvipharm Labs in Paris, France. A quick background regarding the tested molecule. LIB01 is a semi-synthetic molecule originating from the root of a tree that you see in this picture and extensively present in Madagascar. Actually, the ground root that you can see here of this tree has an ethnopharmacological use among local population. Decoction is prepared from these ground roots and ingested for 3 consecutive days for treatment of sexual disability. A collaboration between Uppsala University in Sweden and the Institut Malgache des Recherches Appliquées in Madagascar allowed the isolation of the active molecules, mainly libiguins A and B, and then the semi-synthesis of libiguin and their analogs, mainly one molecule that they named it LIB01. Thus, the aim of this work was to conduct a proof of concept study to investigate the effect of LIB01 on erection in anesthetized rats. For this, we used adult male Wistar rat that received LIB01 at 4 or 15 milligram per kilogram or its vehicle once daily for 3 days. Then erectile function was evaluated either 24 hours, 48 hours, or 7 days post-last administration. In addition, as listed in this table, a positive control group of rats that received a single acute IV injection of sildenafil was also included. The erectile function was evaluated by a routinely used method in the lab, the electrical stimulation of cavernous nerve in anesthetized rats. Briefly, after anesthesia, we implanted the electrode at the level of cavernous nerve for electrical stimulation and a catheter for intracavernous pressure measurement. Then, if sildenafil treatment is given, an IV then is performed 4 minutes before starting the evaluation that consisted as stimulating the cavernous nerve with 7 different frequencies in randomized manner. When stimulating the cavernous nerve, an increase of intracavernous pressure is registered as shown here. The response reached a plateau, and then the stimulation is stopped. And after a certain delay period, the pressure returned to its baseline level. From this, we computed 2 parameters, the delta ICP, which is the pressure difference between the baseline pressure and plateau pressure. And this was normalized by the mean arterial pressure that is measured in the same time. And the area under the curve of the whole response, and this was also normalized by the mean arterial pressure. In this model, as you can see on the upper graph, LIB01 at 15 milligram per kilogram, here in red, led to a significant increase of erectile responses elicited by electric stimulation of cavernous nerve compared to vehicle group in black. And LIB01 at 4 milligram per kilogram in orange here did not show any increase of erectile responses. And this whether we're talking about delta ICP over map or AUC total over map. And the effect of LIB01, as you've shown in the bottom graph, is comparable to the pro-erectile effect of sildenafil shown here in green. The second part of the study consisted of evaluating the duration of action of LIB01. And as you see on this graph, the effect of LIB01 on increasing erectile response was higher when the erectile response was evaluated 48 hours after the last administration, here in blue light. And this increase was maintained up to 7 days post-last administration. Actually, as reported in this table, if we compute the percentage increase between vehicle and LIB01 response at 10 Hertz, why 10 Hertz? Because this where the responses reach a plateau, we see an 11% increase if the erectile response is evaluated 24 hours after last administration. This increased to 36% if evaluation is 48 hours after last administration, and reach 50% if the delay period between last administration and erectile function evaluation is of 7 days. So the main conclusion of the study is that LIB01 at 15 milligram per kilogram exerted a pro-erectile facilitator effect in this model, and this effect was maintained at least for 7 days after the last administration. Thank you for your attention, and I will be glad to answer any question.